In the name of Allah, hello everyone. Good afternoon. Hoping all of you are in good health. I'm thankful for inviting me to this conference to share my knowledge with you. And I'm going to talk on camel milk and natural health. Why my concentration is on diabetes. You see here, 83% of camel population, they are in African countries. And 10 top camel countries are African countries, and as well as Pakistan. In about 82.5% of milk in the world produced by cow, and camels only produce 0.3% of milk. That is a very low level in compared to other livestock milk. But as you see here, camel production in the world is increasing. There is not any big difference between camel milk and the other livestock milk in general composition. And the important difference between them is in bioactive components, as I explained in next slides. Why we consider camels as a sustainable animal and future hope in the climate changes. As we know, camels can tolerate harsh environment, and they are very important livestock species under climate changes in compared to other livestock. And physiologically, camels adapted to live in hot and dry condition. So they are very important food security resources for arid and semi-arid environment. And camel milk has nutritional value, and it's considered to be a nutrition superfood for most nutritional deficiency. There are many differences between camel milk and other livestock milk. Here I try to review most of them. Camel milk is rich in vitamin C, vitamin B3, manganese, iron, copper, and zinc. And also camel milk is a suitable substitute for human milk and a great alternative for kids with allergy to cow milk, because it doesn't have beta-lactoglobulin, and its beta-casein is different and is in very low level. As we know, these are two allergic protein in cow milk. Camel milk has a high amount of unsaturated fatty acids, and they are very beneficial for heart health. And the lactose of camel milk is more digestible for lactose intolerance cases. And camel milk has one acidic protein that is protease inhibitor, and it's very important for longer storage of raw camel milk. Vitamin C in camel milk is much more than other livestock milk. It's about 52 milligrams per liter. And as you see here, vitamin C in camel milk is much more than cow and buffalo milk. There are some protective protein like lactoferrin that is antibacterial, antiviral, and immunomodulatory agent in camel milk. And lactoferrin activity is higher in compared to other species, and also higher concentration of lysozyme, high peptidoglycan recognition protein. These are also antibacterial, and lactoperoxidase in camel milk is against gram-negative bacteria. And this lactoperoxidase system is very important and as alternative method for preservation of raw camel milk when we don't have access to cooling or heating process. Camel milk has small size immunoglobulins, as we call them, nanobodies, and they strengthen immune system. And camel milk has the highest amount of IgG and compared to other livestock milk. And especially camel milk is a rich source of insulin, insulin-like protein that is about 52 units insulin per liter. And it will be helpful for type 1 and 2 and gestational diabetes. And camel milk has special lactic acid bacteria, and they are a very important probiotic for gut health and function. Regarding to these important properties, as I explained in previous slides for camel milk, we can say camel milk in raw and fermented products has some therapeutic effects for health complications like stomach ulcer, liver disorders, diarrhea, cancer, hepatitis, autism, cardiovascular challenges, skin issues, inflammation, food allergy, and lactose intolerance issues, and diabetes. And fermented camel milk is used for tuberculosis and chronic gastrointestinal disease. One of most important effects of camel milk, medicinal effects of camel milk, is anti-diabetes effects. Nowadays, people, they are looking for natural healing, and in some area in the world, they use herbs and also camel milk. Scientifically, camel milk contains insulin-like protein that is covered by fat micelles in this milk, and it's not destroyed in the stomach, and it's transferred to circulatory system for diabetic patients. And also, camel milk has lactoferrin, immunoglobulins, and antioxidant matter. So they have immunomodulatory effects on pancreatic beta cells, and they reduce the required insulin doses in type 1 and 2 diabetes, and they improve the wound healing process during diabetes, and they enhance kidney and liver function and cardiovascular challenges in type 1 and 2 diabetic cases. How camel milk can control blood glucose? There are some mechanisms. Camel milk has effect on insulin receptors activity, and it increases signaling in insulin sensitive tissues, and it has effect on pancreatic beta cells function, and also it can inhibit glucagon receptors and the activation of glucose transport in these cells, and it has effect on inhibition of DPP enzyme, so they can increase insulin secretion. You see those mechanisms here, how camel milk and its components are effective on insulin receptors, glucagon receptors, and glucose transport in these cells. And also how it's effective on pancreas, normal function of pancreas for insulin secretion. You see here the effect of camel milk and its components like lactoferrin on signaling on these cells. So the glucose uptake into these cells will be increased. This is very important for type 2 diabetes. You see here how camel milk and its bioactive components can reduce the required insulin doses about 46% after 2 years taking camel milk by patients. And here also it happened by using camel milk with insulin together in the patient after 16 weeks. It is proved that using raw camel milk in type 1 diabetic patients causes to increase the insulin secretion and reduce blood sugar. And also it reduces the required insulin doses about 30 to 35%. It is proved in many studies in animal cases and human cases and animal models. And also it can prepare about 60% of insulin in diabetic cases and reduce the insulin resistance. So all of them cause to improve the glycemic control for these cases. There are many studies, many researches on using camel milk for diabetic patients. Even we can say the most studies on medicinal effects of camel milk are on anti-diabetic effects. In animal models and the human cases, so most of them, they reach the same result. That is, camel milk can improve the condition of this patient and also can reduce the blood sugar. I review some of these important studies here. In one study, researchers, they used 500 milliliter raw camel milk for 16 weeks in type 1 diabetic cases, and they reached to this result that camel milk can decrease the required insulin doses and blood sugar. And in other study, using raw camel milk in type 1 diabetic cases for 52 weeks and 3 months, caused to reduce the blood glucose and also 30% reduction in required insulin doses. In other studies, it was done on type 2 diabetic cases, and they used a 500 milliliter pasteurized camel milk for 2 months, and it increased the required the insulin concentration, but there is no any effect on other items like blood sugar, blood pressure, insulin and insulin resistance. In other studies, camel milk used in type 2 diabetic cases for 2 months, and they indicated that increasing in insulin concentration and also decreasing blood glucose and required insulin doses. And in other studies, they used camel milk with insulin together for type 1 diabetic patients, and so they reached to this result that the daily doses of insulin will be reduced by 66% after 12 weeks. And in other studies, fermented camel milk used for type 2 diabetic patients, and blood sugar reduced in this study. The other important property of camel milk is its effect on bacterial viral infections. Camel milk has some protective protein and enzyme. They have antimicrobial and immunological properties. One of them is immunoglobulins. It protects the body against bacterial and viral infections. And also camel milk has small size immunoglobulin, 10 times smaller than human antibody. And also it has highest amount of IgG compared to other meat. So it can boost immune responses. Using milk IgG causes to some effects like it can neutralize infection of human cells and limits the gastrointestinal inflammation. And also this IgG, milk IgG, can enhance the phagocytosis and killing of bacteria and supports the gastrointestinal barrier function. And IgG in milk, especially in camel milk, can neutralize the viral enzyme. You see here, during this pandemic, some researchers, they applied camel nanobodies for COVID-19 cases, and they reached to promising results in this regard. The other important antimicrobial components in the camel milk is lysozyme. It cleaves the bacterial cell wall and enhances immunity against pathogens. And lactoperoxidase also it's against gram-negative bacteria, and it is proved that it's against E. coli, Salmonella typhimurium, and Staphylococcus aureus. Peptidoglycan recognition protein is the other important antimicrobial components in camel milk, even it's only found in camel milk, but in some other studies they detected in other livestock milk. It can bind the bacterial cell wall and then activates the pathogenic bacteria, and mainly it against gram-negative bacteria, and it stimulates the immune responses. Casein macropeptides also it inhibits the bacterial and viral adhesion and enhances the bifidobacteria growth in the gut and modulate immunity. And the most important antimicrobial components in camel milk is lactoferrin. It's antibacterial, antiviral, and it inhibits the virus entry into the host cells. You see, camel milk has the highest concentration of lactoferrin, lysozyme, and IgG compared to other species. All of these components, as I explained in previous slides, cause to immunity against microbial infections. But the most important of these components is lactoferrin. It has some physiological activities, as you see here, and we consider it as nutraceutical supplement. It was firstly isolated from bovine milk, then from camel, sheep, and goat milk, and it's also produced by neutrophils and mucosal epithelial cells. The structure of lactoferrin you see here, and important source of lactoferrin is milk, especially camel milk. Camel milk has 10 times, the camel milk lactoferrin is 10 times higher than other milks, and it was about 0.22 milligrams per milliliter. Camel milk has effect on immune responses because it can, the lactoferrin can regulate a modulation of cytokine, chemokine production, and stimulation of phagocyte capacity of cells, and lytic activity, and activation, proliferation, and motility of immune cells. Lactoferrin in camel milk has another important property, that is antibacterial activity. It's against it has bacteriostatic and bactericidal function, both of them. And also it can be against gram-negative and gram-positive bacteria. You see here, and in this table, you see the effect of camel milk against gram-negative, gram-positive, and some resistant pathogenic bacteria like Clostridium, E. coli, Helicobacter pylori, Staphylococcus, and Listeria, even Mycobacterium. Lactoferrin has effect on viruses also. It's against the broad range of DNA and RNA viruses like rotavirus, respiratory syncytial virus, herpes virus, and HIV, and it's a primary defense factor against mucosal infections and cell surfaces because it inhibits the viral adhesion and their entry into target cells, as it can block the heparan sulfate receptors on these cells, and it can bind host cells or virus particles and prevents the nuclear localization of these viruses into target cells. You see the antiviral function of camel milk lactoferrin against viruses, how it can bind virus particles or viral receptors, and it inhibits the virus entry into the host cell, so it can prevent infections. This lactoferrin also is against other respiratory viruses like influenza virus, respiratory syncytial virus, parainfluenza virus, and cold virus, and even fermented camel milk has effect on influenza virus. You see these effects as how lactoferrin is effective on virus entry to the host cells and prevent infections. In this study, also, they applied lactoferrin for COVID-19 cases. This is a very new study, and also in this one applied by bovine lactoferrin, but we applied camel milk for COVID-19 cases. Now we analyzing data, and we reached a very promising result in this regard. Lactoferrin has effect 50% inhibitory on SARS-CoV, that is very close to SARS-CoV-2. And because these two viruses, they are homologous, so maybe lactoferrin also can be effective as a protective factor for this virus as well. The other important effect of camel milk is on autistic children. That is very important. It decreases the oxidative stress and improves the autism behavior. It is proved that when autistic children they consume camel milk, they have amazing improvement in their behavior, motor skills, language, and even social communication, and even emotionality. It's because of immunoglobulins in camel milk, and also antioxidants in camel milk, and also lack of beta-lactoglobulin and beta-casein. So drinking camel milk by these cases, these autistic children, and they will be quieter and less destructive, and they show better emotional expression and communication. The other important effect of camel milk is on hepatitis. Due to high lactoferrin in camel milk, it can inhibit the virus entry and the replication of this virus. The DNA will be prevented, so it recover the chronic hepatitis, and it has effect on cancer. So camel milk stops cancer cells because it activates the apoptosis pathway, and camel milk immunoglobulin, lactoferrin, peptidoglycan recognition protein, these are all anti-tumor matters in camel milk. Camel milk has effect on skin issues due to high amount of alpha hydroxy acids in camel milk. This is anti-aging, and it eliminates wrinkles in skin and also improve dryness. It is proved in some studies clinically. Camel milk has effect on blood cholesterol and cardiovascular challenges due to interaction between bioactive peptides in camel milk and cholesterol. So they reduce the cholesterol absorption from intestine, and probiotic bacteria in camel milk, as lactic acid bacteria, they interfere with cholesterol absorption from intestine, so they can reduce this cholesterol and improve cardiovascular issues. Camel milk has effect on gastrointestinal disorders, like high amount of unsaturated fatty acids and vitamins in camel milk improve metabolism of carbohydrates, and presence of angiotensin 1 converting enzyme in fermented camel milk in high level improve digestibility of camel milk protein. And camel milk also, it is proved that it's anti-diarrhea, because it's rich in anti-rotavirus antibodies. Camel milk has effect on lactose intolerance cases. Lactose intolerance patients, they can digest camel milk very easily. It's because of high concentration of L-lactate in camel milk in compared to cow milk, as it's rich in D-lactate. It's because of special lactic acid bacteria. They ferment lactose in camel milk and make this L-lactate. And camel milk has effect on food allergy due to lack of beta-lactoglobulin and also different and low beta-casein. These are allergic protein in cow milk, and camel milk doesn't have these two protein. So it's very proper for children who they suffering from milk allergy, even it improve the other severe food allergy. Now we reach to conclusion. As I explained, in climate changes and food security condition, camels can produce food, precious food, like milk and meat for humans. So we call camels as the future of the world, the animal of future. Camel milk has precious nutritional value, and it is considered to be nutritious superfood for most nutritional deficiency and human health issues. As I explained, camel milk has high vitamin C and the other bioactive components and even protective proteins, as I explained all of them. So it can be an adjunctive treatment for human serious disease, but it needs more study to prove the effect of processed camel milk or camel milk powder for these issues, because all studies, they are on raw camel milk or pasteurized camel milk, and we don't have more study on camel milk powder, so it needs more study in this regard also. I'm thankful to Faculty of Veterinary and Animal Sciences, Arid Agriculture University in Rawalpindi, Pakistan, for inviting me to this conference. I'm thankful to all participants, and thank you for your attention. If there is any question, I'm happy to answer. Thank you. Do you hear my voice?
Yes, we can hear.
I finished. If there is any question, I am here.
Can I ask one question? My name is Mahbub from South Korea.
Yes, please.
Okay, actually, I'm a animal nutrition student here at South Korea. My question is that there is a lot of information in your presentation. What is the application of camel milk in especially infant formula, and how can it be useful to boost the what I say, like amino activity in young babies or growing babies? Is there any study reported like that?
Yes, not many studies, very few studies there is on this topic. You know, we have very big problem for making powder in camel milk, because we consider camel milk as medicinal milk, not like other milks. So we have to be careful for making powder. Usually we use two processing methods for making powder, infant formula, or other purpose, not difference. We use freeze drying or spray drying. Freeze drying is very expensive, so most of this industry or factory, they don't use it. And it's very important we be careful about bioactive components in camel milk, because we need them. If we don't care about processing method for making this powder, we lose all these bioactive components. So there is not many studies when we make this powder, how much of these immune boosters will remain. Really, we don't know. Maybe most of them, they degrade. But if we use freeze drying, they maybe more than 60 or 70% of them remain. But by spray drying, we should not expect anything from this powder. But it needs, if we care about freeze drying and use this processing, so we have very good formula as immune booster.
All right, thank you very much for your answer. Again, I would like to ask that there is a case study you reported in your presentation that camel milk is effective against COVID-19 and other things. So again, my question is that, is there any vaccine in the global world available which has commercially used camel extracts or camel bioactive compounds or immunoglobulins to produce the COVID-19 vaccine? Is there any study reported like that?
You know, the last year at this time, at first time, I gave this idea to the world in one of my presentation in Italy. And I, because of many studies I did, and I said the camel milk, lactoferrin, and immunoglobulin, they are very strong antiviral agent. So if we can isolate and extract this lactoferrin as antiviral agent, it will be not like vaccine. It will be helpful. It can, I explained the mechanism, how it can bind the virus particles, and how it can bind the can prevent virus entry into the host cell. So it's very important for us. That time, since 1 year ago, we started as a teamwork from many countries. We started working on this project to isolate this lactoferrin as a nutraceutical supplement for COVID-19 cases. But it's very expensive way to isolate lactoferrin. Until now, I can say we could not isolate. And then I gave this idea again. We can use camel milk, whole camel milk, because there are many bioactive components. All of them, they can boost immune system, and also they are antiviral. Yes, okay, not any study. Only we started to do this study, and it's in progress.
So much, Professor Taherah, for being with us in this valuable time and for such a valuable talks. Thank you so much once again.
Welcome.